Hello friends, welcome to NYK Naturals Ayurveda Academics. In this video, we are discussing a very important and interesting topic, that is investigations of infertility. This is important for short essay type questions as well as long essay type questions, and very important in practical aspect also during the practice. So let's study this topic together. First is, in investigations, we are studying objectives of investigations. What are the objectives of investigations? Means to detect the etiological factor or factors. Why we are doing investigation means to detect the etiological factor, to detect the causative factor which causing the infertility. Okay, this is the first objective. Then to rectify the abnormality in an attempt to improve infertility. By investigations, we are going to find what is abnormality is there, and when we find the abnormality, we can treat it as per. Okay, that's why. And third one is to give assurance with examination to the couple if no abnormality is detected. After the investigation, when we come to the conclusion that there is no any anatomical or physiological abnormality in the patient, so that we can give them assurance, that no need to worry, no abnormality is there. Okay, like that. To give the assurance, we need these investigations. These are the main three objectives of investigations. Okay, next, when to investigate. Okay, here two conditions. First one is, we know the definition infertility. Okay, we know the definition infertility. After 1 year of unprotected regular and frequent intercourse, if the couple unable to conceive, then we need to investigate. Infertile couple should investigate it after 1 year of regular unprotected intercourse with adequate frequency. This is the first. Then if the female aged 35 or more and male is 40 years or more, then we need to investigation after 6 months only, after 6 months of regular unprotected intercourse with adequate frequency. These are the two durations. Then next, what are the basic investigations we are going to done? First one is semen analysis, second one confirmation of ovulation, and third is confirmation of tubal patency. Approach to investigation in males. Okay, first, detailed history should be taken. We should not ignore any points in the history. First, in history also, age of the person, duration of marriage, if there is a history of any previous marriage, proven fertility if any in previous, then general medical history, especially with special reference to sexual transmitted diseases, mumps, orchitis, diabetes, recurrent chest infections or bronchiectasis. These are the general medical history related points. Okay, we need to take the detailed history regarding these points. Then history of relevant surgeries in previous, such as herniorrhaphy or operation in testes, like this, any history of surgery is there or surgical history is there, we need to take. Then sexual history of a person, then social habits like heavy smoking and alcohol. This is all regarding the history. Okay, then examination. When it comes to clinical examination, first we need to do full body, full physical examination, and then reproductive system examination. In reproductive system examination, inspection and palpation of the genitalia should be done. Then when it comes to investigations, first routine investigation, in that urine, blood, sugar levels, and semen analysis, in that it is the first step of investigation. Semen analysis. Semen analysis is the first step in investigation of infertility in male patients. In that, first point is collection of semen. How it is done means, collection of semen is done by masturbation. Masturbation is the first choice of method of collection of semen. If the person fails to collect semen by masturbation, then he is advised to collect by coitus interruptus, that is by withdrawal method. These are the two methods for collection of semen, but masturbation method is more preferred than the withdrawal method. Then collected semen should be stored in clean, wide-mouthed and dry glass jar. This is the storage. Then collected semen sent to lab early, and examination should be performed within 2 hours. Immediately after collection, the semen should be sent to the lab, and the examination or analysis of the semen should be done within 2 hours of collection. It is about collection of the semen and examination time. Then precaution. Coitus should be avoided for 2 to 3 days prior to the test. Prior to the semen analysis test, the person should avoid the coitus 2 to 3 days prior to the test. Then semen analysis normal reference values. This point is very important for MCQ as well as only semen analysis. They can ask for SAQ also, that is 5 marks question for the university. In semen analysis, the volume should be 2 ml or more, pH 7.2 to 7.8, that is slightly alkaline, viscosity less than 3, sperm concentration 20 million per ml, total sperm count more than 40 million per ejaculate, and motility should be greater than 50% progressive forward, that is the sperm should move progressively forward direction. Then morphology greater than 14% with normal form. Then viability 75% or more living. Then leukocytes less than 10 million per ml, 1 million, sorry, less than 1 million per ml. Then round cells less than 5 millions per ml. Then sperm agglutination less than 10% spermatozoa with adherent particles. These are the normal reference value in semen analysis. We studied the semen analysis. Okay, semen analysis was the first step or first choice of investigation in infertility in the male patients. Then in selected cases we can also do creatine phosphokinase test and reactive oxygen species test. These two are considered as sperm function tests. Next, in-depth evaluation after semen analysis. Also, what are the tests we can do? We study that here. For in-depth evaluation, the indications are azoospermia, severe oligospermia, low volume ejaculate, problems of sexual potency. After semen analysis, we come to know these conditions. The patient is having these conditions. Then we should further proceed with the further investigation. What are them? Serum, FSH, LH, testosterone, prolactin and TSH. We should investigate these tests. In that, if the patient is having testicular dysfunction, means there is a rise in FSH and LH. There is a rise in FSH and LH hormones. If the patient is having hypogonadotropic hypogonadism, then there is a decrease in FSH and LH hormone. Now, next, Leydig cell dysfunction. If the patient is having Leydig cell dysfunction, then there is a low testosterone and high luteinizing hormone levels. Then, if the patient is having pituitary adenoma, then increased prolactin is present. These are the values. From these values, we can diagnose the underlying condition. For that purpose, these investigations are important. Next, fructose content in the seminal fluid. If the fructose is absent in the seminal fluid, means there is a congenital absence of seminal vesicle, or portion of ductal system is absent, or both are absent. That is, both seminal vesicle is also absent and ductal system is also absent. This indicates absence of fructose indicate these conditions. Then testicular biopsy. It is done. Why testicular biopsy is done means it is done to differentiate the primary testicular failure from obstruction. Here the patient is having azoospermia or severe oligospermia. Then we have two confusing diagnosis, that is either patient may having testicular failure or any obstruction. To differentiate these two conditions, testicular biopsy is indicated, and here it is given that biopsy material should sent in a bovine solution. After collecting the biopsy material from the testicles, it should be sent to lab for investigation in a bovine solution. Rectal ultrasound, TRUS. It is done to visualize seminal vesicles, prostate, ejaculatory ducts. If any obstruction in these structures can be diagnosed by the transrectal ultrasound. When it is indicated means in azoospermia condition, in severe oligospermia condition, in abnormal digital rectal examination, ejaculatory duct abnormalities, for example cyst, any dilatation in the ducts or calcification in the ducts, or genital abnormality. These are the indications for transrectal ultrasound. Next, vasogram. Vasogram is a radiographic study done to evaluate the ejaculatory duct obstruction. Here, ejaculatory duct studied by the radiograph. Radiograph is nothing but vasogram. It is done to evaluate the any obstruction in the ejaculatory duct. Now, in the book it is given that vasogram is almost replaced by the transrectal ultrasound. Then, karyotype analysis. It is done in azoospermia or severe oligospermia associated with raised follicular stimulating hormone levels. Here we can diagnose Klinefelter syndrome like that. Then immunological tests. Presence of sperm antibodies in cervical mucus is demonstrated by the postcoital test. Regarding postcoital test, we discuss the topic in further upcoming videos. Then presence of plenty of pus cells. If in case in semen analysis we diagnosed there are plenty of pus cells in the semen, means we should collect the fluid and it should be examined by staining and the culture. Then by culture, we are going to identify the organisms causing infection there. When we diagnose the organisms causing infections, then we can give suitable antibiotics for that organisms to the patients. These are the investigations performed in the male in the diagnosis of infertility. I hope you understand it well. Thank you for watching.